In Utah, pediatric cases are rising at an alarming rate, especially in high schools. 2 children have died under the age of 18 from COVID since the start of the new year. So that means 5 kids have died from the virus since this pandemic began in March of 2020. That's in the state of Utah. ABC4's Jordan Burrows joining us live from Riverton High School tonight. And Jordan, we know Riverton's experiencing a high case count. Where are the other trouble areas? And what do parents need to know today?
Yeah, good questions, Emily. There are 8 schools within Salt Lake County that are going through those test-to-stay protocols, including here at Riverton High School. Doctors say that parents should not get a false sense of security because of the low numbers of COVID-19 deaths with those 18 years of age or younger. Doctors also say they see this trend with those 18 and younger keeping up at least until the next couple of weeks.
The good news is when children are diagnosed with COVID-19, most of the time symptoms are milder than adults and they are less likely to be placed on a ventilator.
But the bad news is that we probably will end up with a lot of children in hospital, and it's something we should do everything we can to avoid.
Omicron has shattered the state's COVID counts, especially when comparing schools. This is data from the Salt Lake County Health Department. Immediately looking at the data, there's 2 things to notice. 1, the dark blue line is from the 2021-2022 school year, and cases have continued to outrank the previous year's mark. Also, look at January's numbers. The dark blue line went from 10,000 cases from 1 year of data, and in the last 10 days, that number is now more than 16,000. That's 6,000 additional cases.
With this incredibly infectious new virus in Omicron, I worry that we're going to see a big surge of infections in school.
Dr. Andy Pavia is the chief of the Division of Pediatric Infectious Diseases at University of Utah Health. He's also the director of hospital epidemiology at Intermountain Primary Children's Hospital. He's been helping people better understand the pandemic since it began. He says he's thankful Salt Lake County has instituted a 30-day mask mandate. He says that, with a mix of proper ventilation and social distancing, helps slow the spread.
If your child goes to a school where people are not wearing masks, I think it's a very unfortunate situation. I don't have any other way of expressing that.
Dr. Pavia says typically what happens on the Midwest and East Coast with COVID-19 is what happens here in Utah. So with that in mind, he says those numbers typically lag behind it for about 2 weeks. So he says give about 1 to 2 more weeks with this rise in COVID-19 cases. Reporting live in Riverton, Jordan Burrows, ABC4 News.